Once again, we're here at Performance Medicine in Johnson City. I'm joined by Dr. Tom Rogers. We're talking about your thyroid and all the different issues that gland produces for everyone.
Right. You know, at Performance Medicine, my specialty has really evolved into helping people lose weight and evaluating and treating hormone problems. Right. Thyroid is probably one of the most common and also misunderstood hormones out there. Your thyroid gland is in your neck. It controls your metabolism as well as a bunch of other stuff. So what I find is a lot of people that have a lot of symptoms of a low thyroid will go to their doctors and be told, get the blood test and be told that they have a normal thyroid, when in fact it's really on the low side. I call it subclinical hypothyroidism. In medicine, with laboratory results, we're basing everything on a huge bell curve. So if they're within the 96th percentile of anything, a lot of times doctors tend to tell them that they're normal, when in fact they're on the very low end of that curve that's based on an average population anyway.
Well, what are some of the symptoms we need to be on the watch for when it comes to our thyroid?
Typically, more women have thyroid problems than men, and it's usually low. But symptoms of a low thyroid are being tired, having a hard time losing weight, thinning hair, brittle nails, dry skin, constipation is a big one, having cold hands and feet, or running a subnormal temperature. You need to really look at your thyroid. And also, when you check thyroid tests, a lot of times you have to know the right ones to check. The one I rely most frequently on is a free T3, which a lot of people never even check. But again, it's most common in women. I treat a lot of thyroid issues.
And how does that treatment present itself? What treatments do you offer?
Well, in general, you know, I usually look at their other indices on their metabolism, but if it is in fact low, I tend to use more of the natural thyroid replacements like Armor and Nature-Throid. Sometimes I will use Synthroid, which is T4, but what I find is a lot of them won't convert that T4 to the active form of thyroid called T3. So, and sometimes I'll look at their iodine levels, their adrenal glands. I mean, it's kind of complex, but you know, if you think you may have a thyroid issue, a lot of times you're right.
Okay, and you need to get in here and check it out. All right. Dr. Tom
Thanks,
Rogers,
Chris.
as always, great information.
Thank you.
Great information about your thyroid, and if you need to check things out, come down and see Dr. Tom Rogers here at Performance Medicine, or get on their website. Check out performancemedicine.net.